we know that men's testosterone levels have been declining significantly for the last several decades, and they kind of coincide with the increase in industrial chemicals that are being produced, as do all the endocrine disorders that we're seeing. You know, they run parallel. But with testosterone, you know, as you mentioned, in the fetal development, during fetal development, that's a one-way street, right? It's not reversible. And so anything that can affect testosterone levels during fetal development, or maybe even during the neonatal period, hasn't it been shown to lead to disturbed testicular development and result in reproductive organ abnormalities such as hypospadias and cryptorchidism and reduced anal genital distance, which you've mentioned before? And also some of the data out there, the research, and this might, you know, hit a nerve for some, but it can also lead to gender identification issues, as well as negatively affect neurobehavioral development and really increase the risk of hormone disorders later in life.
I think you're spot on with much of that. When you're referring to the increase in cryptorchidism and hypospadias and testicular cancer, for example, this is part of something called the testicular dysgenesis syndrome, which is related to endocrine disruption during development. We know that there are many chemicals which are associated, not all of them with all parts of that syndrome, but some of them parts. So my colleague Shauna Swan has published a book about a year or two ago called Countdown, in which she predicts that most men will be infertile by about 2050 and that's associated with a decrease in sperm count, which is being seen certainly in all the developed world.